Just wanted to start off the conversation this afternoon with a little education on the in-house channel. I know that there's some people that have discussed having volume problems, not hearing the presentations, the Vesper services. If you take a moment to find your Spectrum remote, your Time Warner remote, and turn up the volume on that remote as well as on your TV, you should be able to hear the presentation well enough. I usually start off my chats with a little humor, and I was talking to my father who lives in Missouri, and I said, you know, there's a toilet paper shortage that everybody's really concerned about. We don't have that problem here. We have plenty. We're fine. But a lot of people are hoarding it. They're going to the stores and buying it out, and basically the shelves are empty. I said that Missouri was in a much better place than Texas. And he said, well, why is that? I said, well, the leaves are bigger in Missouri than they are in Texas. Our little oak leaves here you can't do much with. So I want to thank you all for attending. Good afternoon. Thank you for listening to this presentation. Originally, I was going to talk about the expansion because of all the COVID-19 issues and concerns. I'm not going to do that today. I'm going to focus on the COVID-19 virus. I want to take a moment and thank all of you for your cooperation. Everybody's been very kind. I know that the messages have been rolling out, the educations have been rolling out pretty quickly, and I appreciate everybody's compliance with those. We really deeply care for all of you and know that this is a difficult time for all of you. Our first priority is always to create a safe community for our residents and associates every day. So we're working hard to do that. I really do appreciate your cooperation. I'm going to talk about a few things that we need to think about over the next several days. We're planning for this to be several weeks, potentially. So we're really trying to conserve our resources and make sure that we do a good job and are good stewards with the resources that we have. We have been and are continuing to monitor the situation and are implementing all measures proactively to protect the safety of our residents and associates. I hope you feel like that. I've gotten a lot of great positive comments. I really appreciate that. Only a few people have been mad at me so far, so I appreciate that very much. Just some reminders, we are not having any group activities. We're not having any group trips. Our amenities are still open, including the library, the ice cream and coffee area, the pool, the art studio, game room, lobby, solarium, puzzle areas, courtyards, little store, etc. We do ask that you do your best to practice social distancing.
Closer.
I need to be closer?
Yes.
Oh, sorry. I'm being told I need to be closer to the microphone. Sorry about that, folks. Again, I was just saying that all of our amenity spaces are open for business. We do ask that you practice social distancing and that no space should have more than 10 individuals in it at a time. If we see that, we're going to discourage you from attending. We're going to ask you to go back to your apartments, and that's for your safety. Again, we're not having any group transportation at this time. We are providing individual necessary medical transportation only. So only those absolutely necessary trips. And we're sanitizing in between uses. We're strictly adhering to the visitation policy currently in force. In effect, that means only essential healthcare personnel unless end of life or resident wellness is affected. So only absolutely necessary visitation is allowed at this time. It's being restricted otherwise. Everyone must be screened before entering the community, including a temperature check. All the employees, personal service providers, anybody that's absolutely necessary. The residents are also being screened when they come back from trips. We want you all to go to the healthcare center lobby and get screened at the lobby in the Preston if you're closest to that entrance. We also want everybody to practice good hygiene, including hand washing and hand sanitizing. Please cover your mouth with your tissue or the inside of your arm, elbow when you cough or sneeze. If you travel or know someone that is traveling or has traveled, please contact Rob and Akins. We want to keep track of that. We have required people to isolate if they've had recent travel. There is an instance where we've had a resident that was at a theater with a positive case of COVID identified after she attended a theater event up in New York, and we've asked that individual to self-isolate off-site. She reports to us daily any signs or symptoms and her temperature every day. So she's isolated for the full 15 days and won't be allowed to come back to the community until she's cleared. And that's an inconvenience for her. I'm well aware we are issuing a credit for her for that inconvenience. But we're trying to protect the well-being of all of our residents and associates. We do encourage you not to travel at this time. We also encourage you not to take any unnecessary trips. There's really no reason to leave the campus. If you could stay on the campus, that's the best thing to do. If you need something, contact reception and we'll try to get it. If you need groceries, we have a little store that's open. If you need something that the little store doesn't carry, call reception and let us know. We'll try to get those items for you. We are still allowing delivery of Instacart and some food items. Also, your families can drop off, but we're intercepting those deliveries at the lobby. We stop them at the lobby and we'll deliver those items from there. Let's see, I'll start with some questions now that we have been submitted either via email or the portal. How is Westminster facilitating communication with residents for outside individuals? So we are doing some FaceTime, especially in the healthcare center. We're currently working on some iPads to be able to check out to residents so that they can talk to their loved ones over FaceTime. We're also recommending phone calls and those types of visits, and we'll help facilitate those. If you need help, just contact reception. We'll try to do that. We'll have those iPads hopefully ready Monday, and we'll start checking those out from my office. Are people being laid off at Westminster? No, we're not laying anybody off. All of our associates are working. We are cross-training associates to work in other areas. So they may, since we're not washing dishes, for example, we may be using some of those people to help sanitize common spaces. Most of our, we're using paper to deliver to the residents' apartments at this point. We'll cross-train all other associates as necessary and use those folks. If you question about going out to the grocery store or going out for a necessary trip, those residents returning should be screened upon entering the campus. Another question we had, why is the mail being delivered to the internal mail cubbies? That's because the Postal Service has refused to submit to the screening that we're doing for everyone and insisted on delivering to the door only of the building. So they won't even come in the building and submit to the screening. So unfortunately, we're having to sort all of the mail at this time. We don't have a key to all of the mailboxes system, so we're just we're sorting that mail and putting it in your cubbies. What if I need something? Who do I call? Call reception. If you need a work order or if you need some repairs in your apartments, you're having IT problems, whatever it happens to be, please call reception, use the work order system. We cannot have you stopping associates in the hall. That's not very efficient. We need to coordinate and prioritize all of the work that's being completed by our associates, so please make sure that you use the work order system, call into reception for any need. And you just do that by calling the main line. How can I view the chat if I missed it live? We will try to post the chats on the resident portal going forward. I'm hoping to keep this chat to about 20 minutes today, and we should be able to post that file to the resident portal. Those are on the resident portal. Will be public facing, so your families can see those as well. Let's see what else. All right, some other questions we received via email. Let's see, why have prices been increased on so many items in the little store? We are not increasing prices. The prices are the same. There are times that when we're purchasing items, closer? When we're purchasing items that they're being increased at the stores. We're also not able to purchase particular brands of items, so we're having to get an example would be distilled water. I think we were getting HEB water. There wasn't any available, so we had Ozarka deliver through our normal water delivery. It's a little bit more expensive, so it had to be increased. But what we typically do is whatever costs us, we pass on to you all residents. We're just trying to provide you a convenience. It's a convenience store. So we're not trying to make a profit on those items. So if you feel like that, I'm sorry, but that's simply not the case. How would you deal with individuals who tested positive for the virus and say that number was suddenly 25? Basically, we're going to use the same procedure that we've talked about. We're going to isolate those individuals and provide limited services. We would probably discontinue housekeeping services and make sure that only essential personnel visited those residents. We would have them in independent living. We would have them isolate in their apartments. If they had serious illness and they required daily treatment, then we would have them sent to the hospital. If it happened at 25, we would do the same things, only on a grander scale. In healthcare, we have plans for allocating specific wings of the building and specific units, apartments to isolate residents and to keep those residents protected and from those that might contract COVID-19. So while a person is waiting for test results, what will they do differently and how will their care change? Basically, it's the same thing. We're isolating those people for a full 14 days. They're reporting their temperature and we're looking for signs and symptoms. I'm told that tests are being turned around in about a week when we do a test. We have tested a couple people, but at this point, nobody has been identified that's a resident of Westminster or an associate of Westminster as being positive for COVID-19. So far, so good. What happens if excuse me. What happens if a member of the food staff tests positive? Will we be told? Yes, like if any associate tests positive or if anybody that you come into contact tests positive for having the virus, you will be told, because that is part of the isolation precaution system. We want to forensically identify anybody that's had contact with those individuals so that we can monitor signs and symptoms and temperature of those individuals. So absolutely, you will be told if you come into contact with anybody, and we'll do our best to certainly protect the identity publicly, but we will address on a case-by-case individual basis. That's considered part of the prevention, and if you've been watching the news, you've heard about that. One question has been reported that some people are receiving breakfast delivery, fruit, cereal. How do we access this? Since continental breakfast has always been free as their charge. So basically what we did when we started the meal delivery system, we delivered continental breakfast to any residents that typically show up at the bistro for continental breakfast. So we had a list of about 60 people. We've had quite a few others reach out to us asking us for that service, and we're providing it on a case-by-case basis. If that's something you need, just reach out to us at the reception desk and we'll try to add you to the list. If you already have supplies at home for breakfast and you typically make your own and you want to continue to do that, that is perfectly fine. And I know that we're actually upsetting some people by waking them up in the morning for delivery of meals. We certainly don't want to do that, but at the same time, we want to make sure that you get everything you need. So we're only going to deliver these continental breakfasts to those people that request it at this time. Also, there was no fruit in the Laurel last night. This person usually picks up a banana at night when they walk their dog. We're not going to put out fruit at the Laurel like we typically do. We don't want people congregating there. We don't want to spread germs potentially. So for now, there's fresh fruit available for sale in the little store for $0.25 a piece. I invite you to go there and get some if you would like. Next week, we'll be possibly rolling out a piece of fruit to be delivered with your meal, whether you choose lunch or dinner. We'll start doing that as a courtesy because I know that everybody's used to getting their fresh fruit. This person had a comment about the calendar. Can it be updated daily? We could see the DVDs. Ruth is doing such a good job of supplying for us, but if we do not go on the elevator, we do not know what is on for the day. We are updating the touchdown system to make sure that we're advertising the videos that are coming up. There was a glitch in the system, and we rebooted the system to allow for that update, so it should be correct now. And we will be producing a calendar for next week with all of these virtual activities discussed on it, and that should be ready tomorrow for delivery. Ruth's working on that right now, and it's typically delivered on Friday for the next week. Some other questions. Some of you should have seen this in the question and answer production that we put out. What is considered an essential visitor? Essential visitors are any healthcare related visitors such as caregivers, doctors, nurses, therapists, masseuses, approved family caregivers, pharmacies, and cable service providers. We are allowing those folks in. And of course, they're all being screened before they're allowed to enter. What is considered non-essential visitors? Social visitors, personal housekeepers, bookkeepers, anything that is not healthcare related or essential to resident well-being. Those are not being allowed. Can I use the pool, fitness center, library, game room, and courtyards? Yes, right now you can. Those are all being limited to no more than 10 people. And if they're a small area like the little store, the library, it needs to be even a lower number than that. You need to be able to social distance, so you should be able to stand at least 6 feet away from the nearest person. And as long as you're able to do that, I think we limited the little store to 5 people, and let's keep it there. How can we remain physically and mentally active during this time? Residents may visit the courtyards, take a walk, access exercise classes offered on 1890. Westminster will soon offer iPads for checkout to help facilitate video conferencing, and there's also assorted activity handouts available at each lobby. Are all residents' activities canceled? As residents, can we still meet? Yes, all of the resident activities are canceled that are sponsored by Westminster. As residents, you can still meet, you can still play card games. Again, we recommend social distancing, make sure you're sanitizing your hands, make sure that if you cough or sneeze that you cover your mouth with your arm, your elbow, or a Kleenex and then throw it away. Am I able to leave the building? Yes. You're not shut down. This is not a lockdown situation yet, but we do recommend that you eliminate all non-essential trips. If you don't need to go, don't go. If you do need to go, is there a way that you can provide for whatever you're needing to travel for to be brought to you? We recommend that highly. If you can stay on the campus, you're safest here. They're not screening in the grocery stores. They're not screening in public places. You need to make sure that you're protecting yourselves and your neighbors and all of the associates that work here at Westminster. So please do not travel. Do not leave Westminster unless absolutely necessary. What if I'm not in my apartment when my meal is delivered? We strongly encourage each resident be available in your apartment to accept your meal. Lunch hours are from 11:30 to 1:30, dinner from 4:30 to 6:30. However, if you are unable to be present, you may leave your door unlocked and your meal will be placed inside your apartment, or call the reception desk and have them contact Brian Grossman, Director of Food and Beverage. I know that this delivery time is inconvenient, but we really need to cooperate with this. That's the best we can do for now. As we continue to deliver the meals, it'll get easier as we go along. The schedule will get tighter and you'll realize, hey, I'm going to get my meal every day at 11:45. And you'll kind of be able to limit yourself to those hours. But for now, we need to stick to these delivery times. 11:30 to 1:30 for lunch. Dinner's 4:30 to 6:30. And we're doing our very best to deliver all of the meals during those times. Are housekeeping services still provided during this time? Yes, scheduled housekeeping visits will continue, but we are limiting to 30 minutes per apartment as a precautionary measure and to conserve resources. The reason for that is we're having to sanitize all of these common spaces as much as possible. I've asked the Environmental Services Director, Antonio, to make sure that we're sanitizing all common spaces every hour, at least every hour, and because of that, we're having to utilize associates that would typically be cleaning apartments, so we're having to restrict the times in cleaning apartments to about 30 minutes. We're also, because of all the to-go boxes, we're having to do more trash runs than we typically would, so that's an issue as well. Since the marketing lobby is closed, what number should I call to place work orders? Residents may call the Preston reception desk, 512-454-4711, or the Arbor reception desk at 512-454-2140 to place work orders. How can individuals other than residents access Westminster community updates? They can gain access to Westminster updates without having to log in to the resident portal by going to Westminster's website and clicking on resident portal tab on the left side of the homepage and then clicking on announcements. My family manages my medication box for me. Can they still do that? Yes, they can. That's considered a necessary service. We would recommend that those folks be limited and the same person do it every week if possible, or every 2 weeks. If you can do that, try to back it off to every 2 weeks. There are also services available through Halcyon, which is a very good provider that can do those things for you if you want to consider that. Let's see. Are there any cases of COVID-19 at Westminster? No, I've already answered that. There are not at this time. If you have any signs or symptoms, please reach out to the Wellness Clinic or contact Robin Akins. Just a few more reminders. Please practice good hygiene. Please avoid trips. If you're feeling sick, please call the clinic or Robin Akins. Please use the work order system for repairs or needs or IT issues as usual. Please stay hydrated. Please call reception if you need anything. They will direct you to the right individuals, and we're coordinating our resources that way, and that's your primary contact for any issues. I will try to do a chat every week, Wednesdays at 2 o'clock going forward. I may get to do an expansion presentation. We're talking with the folks that manage this Touchtown system for us, the in-house channel, so that I can do an actual PowerPoint presentation and speak over it, show you slides. The system's not capable of doing that at this point. This is about as good as it gets at this point, but we'll continue to work on it and tighten up the system. Again, I'll be doing this every Wednesday at 2 o'clock. Ruth is putting out the calendar. We'll have virtual activities soon, even virtual bingo, to try and keep you engaged and happy in your apartments. I ask you to, kind of hunker down, work with us, continue to cooperate with us. We've been through things before as a community, nothing like this, but we've been through those things. The norovirus a few years ago, we were very successful in limiting the exposure of residents to that. In the last few years, we've been very successful limiting the number of flu cases. If you continue to cooperate with us and we all work together, we'll get through this and be successful. I know that. Keep the faith. Appreciate you all. Thank you for the kind comments, and I will talk to you again next week. Thank you.